And one of the interesting topics that's come up out of the stress research literature has been this notion about the importance of being able to self-regulate. And it is one of the major developmental milestones that kids have to meet. And this is, I think, what you were talking about with schools, where we could think about how to give kids more systematic capacity for being able to regulate, so that as they become adults in these very different systems, they've got a set of tools, as well as thinking about what are the environments that we want to have that will facilitate the ability to regulate and the ability to make different choices depending on what the array of options are, because not every situation will be the same and not every tool will work in the same situation. So I think if you think about it from a prevention orientation, then we should probably think really carefully about how do we hand these tools to kids so that when they become these adults facing all kinds of challenges and choices which are inevitable, they have some mechanisms for kind of managing these.
There is a lot of interest to have mindfulness in the schools to really help children manage the stress. Absolutely, and and there has been mindfulness retreats that Thich Nhat Hanh actually went to DC.
But there's not a very systematic approach to it medically. We will be able to train people to actually manage it better.
I think if we could get more of the medical establishment, and not just physicians, but nurses, registered dietitians, allied health professionals, complementary alternative medicine docs to work, to really model. Once they understand the techniques, mindfulness, yoga, tai chi, you name it, they're much more well positioned to advise the patient on a set of options that might be relevant. So I think we need both.
How can technology help us reduce our stress, and how does technology also add to stress?
We have this new mindfulness app